Dr. Shin Moon Seok.
Yes, that's
Is
right.
a Korean doctor, the
Yeah.
most experienced Korean doctor in use of Macrolane.
Yeah.
He treated a lot of patients, not really with Macrolane, but with sub-Q, which is quite similar to Macrolane, and it's the commercial name of Nasha hyaluronic acid for the body here in Korea.
Yeah.
So, how many patients did you treat?
Maybe just I started sub-Q
Yeah.
injection from 2006.
Ah,
Yeah, so now already 30 years have passed.
Oh.
Yeah. Just cases already over 300 cases.
yeah?
Yeah. But it's early I had experience a lot complication.
Ah,
Yeah. It's human or other cells.
yeah?
Sales or medicine,
Yeah.
they don't know why this kind of lump or some
So,
capsular
did
formation.
you have a lot of lumps and
Yeah,
a lot
yeah.
of how percentage? What
Yeah.
percentage of lumps?
It's not high, just
10%.
10%,
10%.
yeah,
So
yeah.
not a slight percentage.
Yeah.
And how did you treat these
Yeah,
lumps, this
yeah.
complication?
Yeah.
By local treatment like hyaluronidasis?
Yeah. Result using the cannula.
Yeah. What was the mean follow-up of these patients? Did you repeat the treatment in many patients?
Yeah, maybe you means the compliance.
Yeah.
So it's in Korea. It's the situation is different in your country or other country. So it in beginning of this procedure, I recommend high larger volume
Yeah.
in a mammary tissue.
Yeah.
It's needed to higher satisfaction.
Yes. How much volume?
Maybe about 7. It's Korean woman doesn't
Yes,
not bigger.
yeah,
in
not
other
bigger, yes,
countries,
as a-
so maybe usually 50 cc
Yeah.
between the 100 cc. 100 is not many cases. Just 50 cc cases.
I have understood.
Yeah.
And how many patients did we repeat the treatment for a second or a third time?
Maybe under the 10%.
Under the 10% did the second treatment.
Yeah. So nowadays I changed the injection
Yeah. Protocol.
Protocol.
Yeah.
So the stepwise injection is the common now.
Yeah.
So it's the first visit in my clinic. I would recommend just under the 50 cc per one side.
So you start with a lower injection rate, and then you repeat injection
Yes, right.
after
So
6
after,
months.
After 6 months again.
After 6 months,
inject
another
again.
injection.
Yes, maybe 10 or 20 cc.
Yeah.
So
And so you increase the
Yeah.
patient's compliance,
Yeah.
and you have more
Yes,
patients
yes,
who repeated
that's
the
right,
treatment.
that's right.
Did you experience some patients who repeated the treatment more than 4 or 5 times?
Yeah.
Yes,
Yeah.
without any kind of problem.
Yeah.
And your oldest patients was of what year? 2006?
2006 no, just 2007. Maybe
007.
One patient.
One patient?
Annually visit my clinic.
Oh,
so
perfect.
Every time visit my clinic 100 cc. Good.
Oh, every time. So
Yeah,
she's
yeah.
quite happy about
Yeah,
the
yeah,
results,
yeah.
and she repeats
Yeah.
every year the treatment.
Yeah, it's in my cases experience just one patient every 6 months visit our clinic, just 20 or 30 cc on one side.
And did you have any problem with radiological evaluation of these patients? Are old or young patients? Are patients who annually do mammography?
Yeah, it's the before the injection, I recommend the patient should check the breast
Before treatment.
before treatment, the mammo or sonograph for evaluation pathological finding.
Yes.
So and then the during the injection, so it's I don't recommend the routinely do the radiologic.
But after the injection, some of his patients repeated radiological evaluation, and you didn't experience any kind of problem of diagnosis Okay.
Normally, in a Korean woman do check breast annually.
Annually,
At that time, you know, there's some radiolucence things in the X-ray. Show at the time.
And so it was you didn't have many problems about the diagnosis. This is a very important thing. So your experience was in start in 2006, and you start to do a great amount of Macrolane. When you experience some problems in terms of lumpiness, hardness, and this kind of things, and you choose to reduce the amount and to do a multi-step procedures with a progressive increase of Macrolane and of Macrolane. It's not Macrolane, it's sub-Q, of course. And after that, you experience nice results in terms of naturality without any kind of big problem of diagnosis. So it's a very interesting sharing of experience. Thank you very much.
Oh, yeah,
Thank you very much.
Yeah,